Ergo Championship. I'm John Thayer on WSMN 1590 AM and WSMN 95.3 FM, Nashua.
The Lucky Moose Casino and Tavern and the River Casino and Sports Bar are the places to win in Nashua. The party never stops and we are ready to host your next celebration. Wheel of Fortune is now at the Lucky Moose, along with all your favorite gaming machines. The best place to watch your favorite team is at the river, while playing your favorite table games and enjoying our delicious food. Visit today and win.
The NASCAR Cup Series.
The King, Richard Petty, is there, and the green flag is in the air.
Takes on the track too tough to tame.
3 wide to the top. Truex gets turned. Oh, and they're piling it up on the back straightaway.
As the NASCAR 75 is honored.
Off 4, final time, crowd on their feet, and Joey Logano has won at Darlington.
It's the Goodyear 400.
MRN's coverage begins Sunday at 2 p.m. right here on Nashua's Home for NASCAR, WSMN.
The views and opinions of the following show do not reflect those of WSMN, its owners, and or associates.
It's time for The Claudette Show. Family values, authentic friendships, and meaningful discussions surrounded by truth and integrity are Claudette's way of life. Join Claudette in the next hour and be part of The Claudette Show. Authentically yours, Claudette Schmidt.
Good morning, everyone. Good morning, everyone, and happy Monday. Today is May 8th, 2023. Sunny, beautiful, and allergies are out in full force. So to the makers of all the anti-allergy supplements, drugs, pharmaceuticals, nutraceuticals, thank you very much. Keeping you employed. It is a beautiful, beautiful sunny day here in the city of Nashua. I just wanted to remind everyone, I'm sorry, I did not say I'm here with my magnificent producer, Johnny Ankers. Want to say hi, Johnny?
Good morning, Nashua, once again. Pleased to be here with Claudette and her guests.
Super, yes, and we do have 2 guests on for you this morning, and it's going to be an exciting, riveting show, and you're going to learn a lot about healthcare. So I hope you stay tuned. And as always, you can find me here and find an archived copy broadcast of the show at WSMN.live. Go right to my page. You can reach me also at WSMN.live/Claudette or Claudette@ClaudetteSchmidt.com. And you are listening to me, Claudette, at WSMN 1590 AM and WSMN 95.3 FM. Also streaming live on my Facebook page at The Claudette Schmidt Show and on WSMN.live. Okay, well, my 2 guests who are here. And the cameras are on in the studios, guys, and this gets all uploaded, I believe, to YouTube. Is that right, Johnny? Where does this go?
This goes to your Facebook page.
Right, but doesn't video go somewhere else? No?
Nope.
No, okay. See, technology, not my friend. He knows, and that's why he's doing the hard stuff here. So my 2 guests this morning are George and Mary Claassen. Claudette needs another cup of coffee. George, or maybe I need less coffee. George and Mary Claassen from Class Insurance Consulting. I love their logo because it's true. And these 2 are a wealth of information. Their logo is, or their mission statement rather is, there is a better way and we can help. So we are going to talk all things healthcare, health insurance, the whole marketplace. Again, George and Mary Claassen. So good morning, guys, and thanks so much for coming on.
Good morning, Claudette. Thanks for having us.
It's a pleasure. I'm so glad that you were able to come.
Thank you very much. It's a pleasure to be here.
Good. I'm glad that you guys are here. So tell me a little bit about yourselves. And wow, this is such a loaded topic. I get so excited about talking about healthcare and health insurance and educating people. And I love what you said the other day when we spoke on the phone, George, that you are both very mission driven. So tell us a little bit more. Start anywhere you want.
Certainly. So I entered the health insurance world around 12 years ago. I was just looking for a career, and I spoke to a couple of people, and I thought, well, this could be a good career path. So I did the studying, wrote the tests, got the licenses, and I started to work in small business benefits.
So as a broker?
Correct.
Okay.
Purely as a broker.
Okay.
And so you're basically in sales.
Mm-hmm.
So you get appointed with all the carriers, and then you put together proposals for small businesses. And if they want to work with you, they'll hire you, and you'll help them get employee health plans in place. And the Affordable Care Act came into force a couple of years later.
Not my favorite thing at all. Anyway.
Yeah, and there's a lot that can be said about the Affordable Care Act, but that's probably better left for another conversation. I think what people really care about is what they face on a daily basis today. But in those days, we started to get these 15 to 20% premium increases for small businesses. And my clients were asking me when I was delivering this to them, why is everything going up?
Reasonable question.
Very reasonable question if you're paying for something.
Absolutely.
And nobody had any answers. I would ask my carrier reps, and they would get back to me with a statement that was probably written by some legal expert.
Sounds about right.
And PR. And I honestly had no answers. So what I did was I started to take a bit of a deeper dive into how health insurance works. And I still didn't get any answers, not ones that made sense. And then one day I met somebody who's become a good friend of mine since, but Dr. Jeffrey Gold, who opened up the first direct primary care practice in Massachusetts. And I went to see him, and I said, why are you doing this? It sounds amazing. And what he basically did was he quit his job working for a large hospital system. And he said, I'm not taking insurance anymore. I'm going to work directly for my patients. They will pay me directly, and I will take care of them. And I asked, well, how much do you charge for a patient? And in those days, it was something like $60 a month. And I said, and that includes everything that he can do in a primary care setting. And when he explained to me what primary care doctors are actually trained to do, I was, wow, we don't see that in the system. In the system, which we've invented, which we call fee-for-service, where every little thing is coded and billed, that's a lot of perverse incentives entered the market there. And in healthcare, that can cause a lot of harm. But basically, when a primary care doctor actually, when he has the time to spend with his patients the way they were trained to do their jobs, if they can spend 30 to 45 minutes per consultation with a patient, there's a lot that they can do. They can take care of basically 90 to 95% of the average American's healthcare needs on a yearly basis. And I was, wow, that is such a good idea. But that's a model that people knew in the older days. That there used to be a community. Every community had its own primary care doctor.
Yes.
They would even do house calls.
Yeah.
If you went to see them, that you would pay at the time of service because it wasn't expensive. You didn't need insurance to pay for it, and that was how the system worked. And people became became primary care doctors because they wanted to help people. They wanted to take care of their communities where they lived, and it worked really well. But then a lot of things happened politically. So historically, that's another subject for another conversation. But
sure, can you just, for our viewers, and our listeners, rather, can you tell them when it was about that you met Dr. Gold?
So that was
2008-ish.
No, it was more like 2011 or 12.
Okay.
So not that long ago, actually. No, excuse me. So that was probably around 2014. Let's pick that date.
No, that's fine. So around that time, he had gone and he had already started his direct primary care business, the model, and was talking about it. Okay, and was successful.
Well, yes, it was a grind because he thought originally he would have a lot of patients from his panel because primary care doctors in the fee-for-service system have an average of 2,500 to 3,500 patients that they have to take care of.
Wow.
Now, it's impossible to keep track of that many people. but because of his the new business model, they take on 600 to 800 patients maximum in their panel, and that means they have a lot more time to spend with their patients, and the results are that they keep people healthy. Compare it to your auto mechanic. If you have a good family auto mechanic that takes care of your family vehicle, somebody you trust, that's going to do the right thing and not overcharge you, they keep your cars on the road for as long as it's economically viable.
Common sense. It's rooted in common sense.
Exactly. You have a relationship with that business, that owner, and it's the same with the doctor. What the fee-for-service system took away from us, the consumers of healthcare, is our doctor-patient relationship. And on a primary care basis, that is critical, because that is your maintenance. That is your day-to-day.
Foundation.
It is.
Sorry, the foundation.
It is the foundation of our care.
Yes, it is.
And if you look at, so internationally, healthcare is a big problem. It's a big expense for governments and organizations and employers. They've done thousands of studies internationally. There's one thing that all these studies agree on, and that is if you want a healthy population, you need to give people easy access to good primary care, period. There's no other way. We turned that upside down, and we made it very difficult to get access to primary care doctors. When you do go into a primary care office that works in the fee-for-service space, which basically means they bill insurance to get paid, you've got about 7 minutes of FaceTime with a physician or a physician's assistant, which could be a nurse practitioner or a PA, a physician assistant. Now, when you do see the actual primary care doctor, they're busy looking at a screen while they're typing. Now, when you talk to doctors...
That is very true. That is, and you know, I'd like to encourage people who are listening to really hone in on that. Your last visit that you had with someone, it rings true for me. You know, you're catching up with them, and they've got the little Dell laptop, and they're scooted up real close to you now that we're past this pandemic that they said we had, and they're type. Okay, what is it? Wait, no, wait, what? Type. And it's like, I just feel like I'm there, and someone who's, what are those people? Transcriptionists.
Scribes.
Scribes. Yes, that's all it is. I'm sorry to say, but that's what it feels like.
But
and we're built for connection, like you're saying.
Right. We are humans. Our health is something that's very personal. And we want to be able to talk about our health to somebody that's trained to help us to live the best possible lifestyle with optimal health. And there needs to be a lot of trust involved there. Unfortunately, what's happened in healthcare in the last 20 years in America has eroded trust on a grand scale. So let's go back to that doctor's visit. While the doctor's typing on a computer, looking at a screen, trying to ask a couple of basic questions to the patient's sitting there desperate to tell the doctor about something that's going on, but the doctor has to go through, check some boxes, make some notes. The reason the doctor has to do that is because if they don't do this the right way, they don't get paid by the insurance company.
Correct.
We talk about that in a little bit more depth in a second, but the doctor's really trying to figure out, who's this patient in front of me? Have I seen them before or not? What is in their notes, in their file? What test can I send them to? What prescriptions do they need? And then what specialist do I have to pass them over to? Because the doctor does not have time to treat their chronic condition, even though in primary care, doctors are very well trained to handle a lot of our chronic conditions.
Yes.
They just don't have the time in the fee-for-service system. Now, for us as consumers of healthcare, when you enter the healthcare space, because most of us don't really know what's going on there until it's our turn, or it's somebody we advocate for, a relative, could be a parent, a child, somebody that needs your assistance and help. Once we see what's actually going on in that system, we feel that we are a dollar sign and a number, and we're getting shuffled through this system to maximize revenues for somebody else. And it's at a very large expense to us. We call this, in my world, we call this perverse incentives. So what happened as well was the independent doctor we talked about earlier that took care of his community or her community. We invented the insurance model, then the HMO model, the hospital systems became very large and very powerful. And what they did was, anybody who wants to maximize revenues in any industry knows you have to control the supply chain, right? So they started to buy up all these independent physician practices.
Very good analogy. I like that, and that makes sense.
Yes.
I don't know. Is that even an analogy? Sorry.
Yeah,
They have to control the supply chain. Yes.
They absolutely.
I like how you break it down and you do that. That's great for people to understand.
So where do referrals come from? It comes from primary care doctors.
Mm-hmm.
Now, what happened as well, in order to maximize revenues, we moved from a healthcare system to a sick care system.
For sure.
That's a profound statement, because the revenues of practicing a sick care healthcare system model is a lot higher than when we actually focus on keeping people healthy. We focus on keeping people off expensive medication. When we focus on keeping people out of hospitals and out of surgery rooms and out of outpatient procedures and facilities, that's not good for revenue. Now, why did the doctors sell to hospitals? And they didn't just sell to hospitals, they also sold to insurance companies. United Healthcare owns the largest physician network in the country right now, and they're still buying up as many as they can.
Wow. Look, when you say still buying up what? Smaller?
Independent practices, independent physician groups, independent
okay.
practices. But
Okay.
they largely go for the large groups, because that's mergers and acquisitions in the healthcare space is the best way to make a lot more money the fastest. And something I was going to mention a little later, but if you look at the stock price of United Healthcare, for the last 10 years, it went up from $50 a share to $550 a share.
Wow.
Now, we should talk about where that money comes from, because that's really important, because this is the pain that working people and small businesses and large businesses and employees and our communities are really feeling. They feel this pain, because this whole system is extracting a lot of wealth from what we'll call Main Street, from our communities, and it goes to Wall Street.
Correct. Now, how can we help our listeners understand or break it down in a way? You're much more articulate and polished than I could ever hope to be. Maybe you need to give me some lessons sometimes, but I'm always correcting myself, and not correcting myself, but trying to get a point across, and I feel like I confuse myself. However, since you explain it so nicely, we can look at the stock and see, okay, it was $50 and now it's $500, right? Is that what we said about for United? But and most listeners and the average consumers know all of this, right? That there's big corporations are greedy and all of this, and everybody's out for the money. What can the consumer do, the listener that's listening today? How can they better educate and inform themselves on how to save money? And that's where you guys come in with what you do, right? What action can they take, so they can make a difference for themselves and their families in these ridiculous premiums?
Well, sorry, I'll just jump in here.
Yeah, go for it.
So the first thing they can do is they can advocate for themselves. They can, when they get a bill, look at the CPT code.
Yes.
Is it correct? Are they overcharging? And this happens so often.
So often.
And they really need to stand up for themselves and actually fight these bills that they're getting, because they're just getting more and more. Premiums are going up out of pocket. Everything is getting more expensive. So they have to advocate for themselves now. For sure. I think, but when most people get a bill and they think, especially if you're in the Medicare population, right? You from that generation, I have to pay the bill, or I'm going to go to collections. Oh my goodness. And you get nervous when you get older too, so you can understand that, right? But what a lot of people don't understand is that the CPT code could be off by a number and you're getting incorrectly billed, but people will still write out that check. Yep.
Yeah, something like 90. There's been a lot of studies done on this. Over 90% of hospital bills are extremely inaccurate.
That's frightening.
Yeah, but the thing is, people have been conditioned not to push back on healthcare and health insurance. There's a lot of ways this happened. Right now, today in America, unfortunately, most people believe without health insurance, you do not have access to healthcare. So people lump health insurance and healthcare in together as the same thing. It's not true at all. One way that something people need to do is they need to educate themselves. Now, that is very difficult on the world's most boring subject. Who wants to learn more about something that's extremely complex? And I say complex by design. Now, for us as consumers of healthcare, the system looks completely dysfunctional.
Yes.
But guess what? It's working exactly the way it was designed. Everything is there for a reason.
Sure.
And in our business, what we do, we follow the money. The answer is always there. And why is this happening? And then eventually figure out, oh, it's the revenues. They do it like this because that maximizes revenue, but at whose expense? So it's always at the expense of the consumer. We are all consumers of healthcare. We're all going to need access to healthcare at some points of our lives. Some people more than others, but you can absolutely bet on it that someday everybody's going to need to see a doctor and a specialist and maybe be hospitalized, and there's stats about that. The thing is, in this system, it's kind of the analogy of the frog in the hot water, right? So
doesn't sound good.
Yeah, so we all know what happens eventually. You become frog soup, right? But you don't notice it over time. The water gets a little warmer. It's okay. It's not so bad. It gets a little warmer now. And from the consumer's perspective, it gets a little bit more expensive. The service becomes a little bit worse. Customer service gets worse. And then you kind of realize later, as I said earlier, you're a number and a dollar sign getting shuffled around. The humanity's been ripped out of it. Now, I never want to beat up on the doctors and the nurses and the people who actually perform the work. They are truly heroes.
Of course,
they have extremely
100%.
difficult job, and we have to remember this system affects them in a negative way too.
Yes.
If we look at physician burnout, and we look at suicide rates of people that work in healthcare, it's one of the highest of any sector in the country.
It's true.
It's absolutely terrifying. Now, these people are intelligent people who go through a lot of pain to get their qualifications and have huge expense financially and personally to them to become the doctors and the nurses and the physician assistants, the boots on the ground.
Yes.
That they are.
And they are heroes, like you said, absolutely.
Exactly. And the system is so fragmented by design that they're never taught in medical school what it's going to be like when you go out there and work someday. It's a rude awakening when they start their residencies and they see, oh my goodness.
Right.
And you want to hear a very scary statistic?
Oh boy.
96% of physicians, say, primary care side especially, they say they would absolutely not recommend that profession to their own children.
That is scary.
But
and you think about talk about mission driven and what makes people become a physician, go to school. A lot of people have stories, right? Just from their childhood, from what they've seen, or a real interest in the science and helping people, right? And then they get thrown into this system, and you can't blame them in one respect. I mean, they have put a lot of time and money and into it, but I mean, now they're thrown into it and they've got to make it work for themselves. So I like how you made that distinction, because that's important. But there is a better way.
Yes, and it's just one of these complex problems where people feel so helpless that there's nothing they can do about it. Now, when we look at health insurance premiums, right? So we look at what companies are paying. So if you have insurance through work, let's say you're a small to mid-sized employer or a large employer, and you look at the total cost of the insurance premiums, and you look at the cost of, say, an individual plan and a family plan, and you look at the ACA, the exchanges, you look at what anybody can buy for themselves. Let's say they're self-employed. They don't get a benefit through work. They have to go to the exchange. And you look at what these family plans cost now, and it's more than the cost of their mortgages across the country.
It's true.
And what do you get for that? I mean,
how can this be?
I'll explain that. But what do we get for when we make a mortgage payment, right? You have shelter. You have a safe place for you and your family. You can grow there, if you can see your kids grow up there,
you have a home.
You have a home.
Yes,
That's very well
yes.
put. And
A refuge.
you feel like you get value from that. It's nice. And then someday it's going to be worth more money, so it's a little nest egg. You feel you get so much from home ownership. But when you're throwing more money towards a health insurance premium than you are to your mortgage, and you're not even going to the doctor, how does that feel? It's like, so I have to pay this, and then every year it goes up. But that's not even the worst part. The worst part is the out-of-pockets on these health plans. So the national average for family plans now is getting close to $3,000 a month.
Holy smokes.
Okay.
Wow.
On that subject, I know a lot of people personally where a household, 2 parents are working, one of them has got a job so that the family can have insurance.
And that's just it, right? Like so-and-so, well, I can't quit because, so-and-so carries the insurance. And we have kids.
There you go. And people are terrified that, okay, if we don't have this, and something happens, we can lose everything. And it's true. So they have jobs. And if you have a job and your employer is contributing money towards your health insurance premium, now this is also where it's very important for people to understand what's really going on. Because if the employer is paying 2/3 of your premium for you, that's money that could have gone to your salary. That's money that you could have saved for retirement, for your kids' education, maybe a little vacation, but it's discretionary income that you don't even see because it doesn't even hit your paycheck. But from an employer's perspective, they need to pay that to attract and retain their talent. But that money could have gone in growing the company. It could have gone to higher wages. It could have gone to research and development. It could have gone to be more competitive.
Sure.
Okay, but it's not. So it's going to the healthcare system. Now, the employee that has this health insurance through the employer still has a payroll deduction because not many employers pay 100% of the premium for their employees. There are some that do, but most across the country, right. It's not very common. So now there's a payroll deduction that hits your paycheck every month as well. So, okay, that's another cost. And it still gets worse. Now, let's say somebody has a medical event and they have to go for doctor's visits, specialist visits, diagnostic testing, maybe some surgery, rehab, recovery, all these things, prescription drugs. The health plans today have such high deductibles that, I mean, there's been many articles recently where they say most Americans don't have $500 saved up for an emergency. Who's got $5,000 to $10,000 saved up for a deductible, right? So what happens is we call those folks functionally uninsured because they're scared to use their insurance because they don't know, in a system with no transparency, they don't know what anything's going to cost them, and they've all been burned. How many people have gotten a $700 bill in the mail for labs? You know what the cash price for those labs are? $3 to $12. Right. But through an insurance card, you're getting billed $400 to $700 for the same test.
And people are probably terrified because they think in their head, I have to have health insurance, but they don't even use it. So it's like this, how does this even make sense? And now, before we go into more of that, I don't mean to interrupt. I just want to remind everyone that you are listening to Claudette Schmidt on WSMN 1590 AM and WSMN 95.3 FM. Also streaming live on my Facebook page at Claudette the Claudette Schmidt Show, and on WSMN.live. So we are talking healthcare. We are here, I'm here in studio with George and Mary Claassen, and they represent the Class Insurance Consulting. It's Monday, guys. And we are getting quite an education here. So we are back at it. Just wanted to remind people where to get in touch and to get the archive broadcast, and you can get it on my page as well. So, George, I'm sorry, you were saying the cost?
Yes, so we're breaking that down. So just to recap, the cost of premiums, let's say for a family plan, is costing more than mortgages now nationally.
Wow.
Then,
that's frightening.
When you use the insurance, you have these crazy high deductibles as well. And the insurance carriers have gotten pretty clever. So let me explain that a little bit. Now, when I started in this industry, deductibles were $0 and $250, and people going for the $500 and $1,000 deductible, that was considered really high and very risky. What if, you know? Today,
I remember those days.
I know.
I do.
Today, if you see a plan like that, they call it a platinum plan.
Oh,
it's
yes.
like, oh, it's the best.
Right.
So
who wouldn't want that,
who
right?
wouldn't
I
want
mean,
that?
come on. I'm going to get the best for my family,
know.
right? Yeah.
I know. And you can't blame people for thinking like that.
You can't.
So, but what's going on is they're hiding a lot of things in plain sight. So you can't say they're doing it on purpose, but we kind of know that they could do it better. Let's just let's be kind and say they could do it better.
Very good marketing departments.
And PR and analytics and revenue. So I always ask my clients when I speak to employer groups, to the leadership team, I say, when we discuss this problem, and I say, but how could this be? How could this happen? And then I'd say, well, how do you make things that are highly unethical legal? And the answer is you use lobbyists. It works.
Of course. I mean, look around, everyone. Wake up. Yes.
Yeah.
Okay.
And I can talk about the political side of this, but I think we'll leave that for another discussion as well. But
that would take up a lot of time.
Yes. That'll really get people fired up.
Well, you don't want to get me going either. Anyway.
Yeah. So as I was talking about things that are hidden in plain sight, what people should really look at when they look at their plan designs is the maximum out of pocket. We call that your financial risk and exposure, because the carriers are putting co-insurance, a percentage of the bill, on things that are expensive, which is inpatient, outpatient, and testing. So it could be diagnostic testing, but they're also charging regular blood work, blood panels at insane, like 10, 20, 30, 40x of what the cash pricing would be for that. So financial exposure. So when you look at a $3,000 a month family premium, and it's split between the employee and the employer, that's $36,000 a year to have an insurance card in your wallet for a family, right?
And that's all it is. It's just to secure that card in your wallet.
That's correct.
Okay.
Now, let's say somebody in the family has a serious medical event and they're hospitalized. And when you're paying 30% of the total bill to get to your maximum out of pocket, which now is between $15,000 to $20,000+ for a family. So it's 36 in premium, plus let's say another 15 on top of that for your maximum out of, because you're going to hit your maximum out of pocket when there's co-insurance. That's $51,000 that you paid to have insurance, and you had insurance, and the insurance was no good because you still had to fork over all that money. Right. Now that's what's getting people totally. That's why they lose confidence in the system. That's why they are disheartened. That's why it's a big problem, because our whole system is a sick care system, not a healthcare system. Now, when
That's
people
true.
avoid things that could easily be treated, guess what? It benefits that system, because what's going to happen down the road is going to be a major medical event, and then everybody's going to scratch their heads and say, if this person went to the doctor 2 years ago, we would have picked this up.
Yes.
And we would have treated this
Yes.
for pennies on the dollar.
Yes.
But now it's serious surgery. It's a long recovery time. They're not working. Then you need other people to help take care of them while they get better. It's a major financial blow to the community, to the family especially, and even to their employer. But to the healthcare system, it's a big win. It's a major win.
Of course, because it's designed to have this happen.
That's right. The revenues go through the roof. So they're kind of, okay. So just to paint this picture to the folks out there, there's 4 major players at work here. You have your insurance companies, your carriers. So that's we call them the BUCAs, Blue Cross, United, Cigna, Aetna, Humana. Humana's getting out of the group space, the health insurance space. They're just focusing on Medicare. So you have your insurance carriers. Then you have your large hospital and hospital groups.
Okay.
Then you have your pharmaceutical manufacturers and your pharmaceutical distributors.
Okay.
And then you have the government. So those 4 forces together, we call them the cartel, because when you look up the word cartel, Go ahead and Google cartel. Actually,
I
go to
love it.
Wikipedia and look up cartel. It say they collude to limit supply to drive up prices. It's
putting on my
to a
glasses. I'm doing
T
it.
our healthcare system.
Well, one thing I'll add to that is back in World War II and some years after that, all of the insurance companies, the healthcare as it was coming to be, was designed to be a not-for-profit. They were there to serve the patient, and they were advocates for the doctors and the physicians. They were not there to answer to stockholders and lobbyists. And the other thing is, insurance companies constantly reduce the amount that they're paying pharmaceutical companies, the manufacturers. That's where I came from. And doctors, as far as the payment they're paying for the doctor, the 7 minutes you talked about. So a lot of doctors have now put in laboratories where they do their testing on site, where before they used to ship the blood off, they're doing it on site, so that can become a profit center to actually subsidize the lack of fee that the doctor is getting for his/her service.
Wow.
And that's a good point. So let's talk about that for a second. So, for every practicing doctor out there right now, they need 3. If it's an independent practice, they need 3 people to do their billing so that they can get compensated from the insurance companies. They need to pay 3 salaries. That's why when you walk into a doctor's office, it's so busy.
Of course.
But there's only 3 doctors there, but
Right.
there's 20 staff, right?
Like 20 receptionists when you look behind the glass screen.
And
right?
it's chaos,
Yes,
right?
yeah,
You try to call them.
Complete chaos.
I need a refill. I need this. It's chaos. I need my test results. Good luck. That's why people are so frustrated about this. They don't feel like they're getting treated like a valuable customer. And it's not that the people who are there in healthcare to serve have this at all. They're not trying to have this result. They're just trying to not drown under all this,
Exactly.
this big burden.
I mean, they come into it with their knowledge, their education to help and serve people, and now they're thrown into the system, and they know that in order to help people, they have to somehow work with it, if you will.
Yes. And if you talk to physicians, that could be specialty, could be primary care, whether they work for a hospital system or insurance carrier or they're independent, most of them spend more time during their work week, more time doing administrative work that has
for sure.
nothing to do with healthcare than they do practicing healthcare on their patients, with their patients. That actual healthcare has got so little to do with medicine today. And then we're wondering, why are the wheels starting to wobble? It's because they're going to be coming off pretty soon. We just don't realize it, because that's that frog in the hot water analogy.
It's very true. And you know what, too, to your point, what was the percentage of the administrative you said? Did you say a percentage or not? Did I make that up?
Well, so here's a very interesting number, okay? Before the Affordable Care Act started, became into full force, healthcare was the largest employer in 3 states in America. Today, healthcare is the largest employer in 47 states in America. Healthcare is the largest employer in the United States of America by sector, and there's about the same amount of doctors and nurses working in healthcare today as there was or were 10 years ago. So this has been one massive administrative job creations program orchestrated by the government, and it's at the expense of people who work and pay taxes, and that can be employees, employers, businesses, and our communities, because there's a lot of wealth getting extracted from Main Street that's all going to Wall Street. And I'll give you an example, okay? In our business, we work with employers to do this better. So we don't go through your traditional carrier insurance. We do self-funded plans. So the employer acts like it's their money that they're spending, because at the end of the day, it is their money.
That's right.
And it is their employees' money, because they're taking payroll
right.
deductions. So there's a fiduciary responsibility there too. So the employers who take this serious, it's they don't spend nearly as much money on as employers who do not take this very serious. Now, I'm not saying there's bad employers out there who's not taking this serious. What I mean is they're not doing nearly as good as they can. And there's a lot of reasons for that. And I'd like to talk about that a little bit later in this conversation. But here's an example. orthopedic surgery, right? There's still a lot of independent surgeons out there. They work out of hospitals and they work out of independent surgery centers that they mostly own. So when you find independent surgery centers in your area, it's usually a bunch of surgeons that are partners in it. So they've got skin in the game. And the reason they do this is because their compensation from performing surgeries in hospitals is very low. But the hospital is charging the patient a lot of money. Now, most patients have health insurance, so the insurance plan gets billed. Now, the problem here is most people think it's just insurance. The insurance will cover it. The insurance will pay for it. But let's look at that a little bit more closely. So one of the surgeons that we work with, I asked him one day, I said, can you get some of the bills from your patients? So send us the medical bill from the hospital that the patient said, here it is, you can share this. Complete shoulder replacement. It was billed by the hospital, a New Hampshire hospital, major hospital, at $170-something thousand for a complete shoulder replacement. Luckily, this patient had health insurance, major carrier in the state. So their PPO discount was they knocked $101,000 off that bill.
Wow, what a big discount.
Wow, phew. I mean, thank
to
goodness.
the rescue, yeah.
Yeah, so 101,000. You know, if people are going to give me a big discount on stuff, the first question I'm going to ask them is a discount on what? You know, somebody says, I'll sell you my house for half price, but what's the price, right?
Exactly.
So then after $101,000 knocked off, the bill is $70-something thousand, right? Now this person who's a teacher had a $5,000 deductible. Okay, so $5,000 came out of his pocket, and guess what? The anesthesiologist was out of network by design. So he had to pay the whole anesthesia bill by himself. Insurance said, not our problem. You're paying for it. So that's $5,000 plus another $2,600. So now the employer has basically $70,000 came out of their health plan, right? Now here's the thing that's going to get people's attention. That same surgeon would have done that same operation at their own surgery center down the road, all in anesthesia, anesthesiologist. It's a whole bundle, all the diagnostic testing before and after, 3 months of physical therapy after, all included in the price. We call those bundles. It's just one price for everything, $25,000. Now, the employers we work with, when an employee says, you know what, I'd like to take that option, guess what their deductible will be? Nothing, because everybody's winning here.
Well,
and guess what?
That's exactly it.
That's it. It's a win-win for all. The surgeon's getting more money than he would have at the hospital. For a lot of procedures, outcomes statistically are better in privately owned, standalone surgery centers than in hospitals. And think about this. So that's a $50,000 difference, right? That came out of that school's health insurance. Today's claims are tomorrow's premiums. Now that's $50,000 that just got extracted from that community and went straight to Wall Street, never to be seen again. Now you replicate this millions of times across the country, and then we wonder, why are taxes going up for property taxes everywhere? I was getting an oil change last week, and so I'm waiting for my car, and I have this TV on with the news channel on it, and there was all these teachers. It was in southern Massachusetts near Cape Cod or somewhere, saying there is a major budget cuts, and it's affecting the education system tremendously. I mean, the teachers are freaking out because valuable, important programs are getting cut. But you know why? It's because of this healthcare system that is literally raiding our communities for every penny they can get their hands on at our expense, and nobody's batting an eyelid. And politically, it's a hot topic. Nobody wants to touch it.
Of course not. Why?
The reason is because every time the government throws a new regulation in there, they create 1 million admin jobs. Okay, so think about this. early 2000s, America lost a lot of manufacturing jobs, right?
Mm-hmm.
Why did these jobs go overseas? There's a lot of reasons for it, but one of them was because it cost less money for a company to open up a production facility somewhere else in the world than it did to just pay the health insurance for that employee and his family.
Mm-hmm.
It was cheaper to just move it all.
We have people flying to Colombia to a spine institute over there. People flying over to Mexico for different alternative health treatments that they can't have access to here, and paying into their insurance. It's a lot of insanity.
Yes.
Like you said, and in the interest of time, I could talk all day healthcare. What do you say? But I want you to finish your thoughts as well. But what do you say to the person that's listening and saying, okay, well, I have to have health insurance. I'm 60 years old. I can't get Medicare yet. I'm working part-time, or maybe I'm even working full-time. And I have to have health insurance because what if something happens to me? Like, how do we break it down for the consumer so they can look at this logically and, outline their steps to, being an advocate for themselves and employing, exactly what you're talking about and saving money?
A very good question. A very complex answer or answers. And there's no cookie cutter, but I'll try to do my best here. I think the most important thing is for all of us is to take personal responsibility for ourselves and our own health. Number one, we have to try to live healthy lives, healthy lifestyles. We need to educate ourselves on that because that's what I call a life skill, and you can be rewarded for that forever, and you can help others and pass that on.
Sure.
And when we're healthier, our families benefit from it.
Yes.
But on the other side, it keeps us out of the sick care system that we have.
Mm-hmm.
So everybody should really do the best they can because the whole deck is stacked everywhere. If you look at just our food.
Yes. Oh, we could talk for days.
Exactly.
Yes.
It's people need to understand what's good nutrition. I mean, we have a 12-year-old. It's so difficult to get that kid to eat healthy food.
It's, no.
Oh my goodness,
Yeah,
but
I know.
We still
the dyes and everything, the red dyes and
that
alone makes
the sugar.
me crazy. Oh,
they're so addicted to it.
Yes.
They healthy food is,
it's
anyway.
more expensive too.
And that's another great topic to talk about. But and actually, about it being more expensive. I've done this so many times. You work out what a Happy Meal for a family. Let's say a McDonald's dinner would cost for a family of 4.
Mm-hmm.
You take that price tag and you go to any supermarket, go to Market Basket. You can buy healthy, fresh ingredients that are minimally processed for less money than that and feed your whole family, and you can put it all together in under 45 minutes.
Mm-hmm.
And you can do it together as a family, and you can all hang out and this and that. But I know it's not, everybody's busy and this and that.
Well, I think that's it, right? That's another factor, and I don't want to segue onto that, but it's time. Like, in the same reason people, how do we get people to take time to really understand what they're paying into? Some people, like you said, you nailed it. They're just so conditioned to go along with whatever.
Yes, we have to. And here's an analogy for you. People will spend more time researching the next flat panel TV they're going to buy at Best Buy, right? Or the next car they're going to buy. They can run through the specifications and the technical details of different models and this and that and weigh up their options. But they don't look at their own health insurance. If they're getting it through an employer, they think open enrollment is the most boring meeting of the year.
Yeah.
And I don't blame them.
Yeah.
I attend these meetings.
Yes.
People go there and they're miserable. And the reason is because now they're like, how much more is this going to cost me out of my paycheck?
Mm-hmm.
And then how much more am I going to pay when I actually go to the doctor and when I go pick up my prescriptions? Because if you look at the trends, and this is another way how they spin it, so it's been up and to the right for insurance premiums going up for the last 10 years. But so has the stock price of all the major carriers in the country, and everybody involved in healthcare on that scale has been making so much money.
Amazing. And that's I like that you pointed that out.
Yeah, so they say health insurance premiums have increased by, say, they say, it's 10%, 11%. No, it's absolutely not true, because when you compare apples to apples and you say your plan 10 years ago at $1,000 deductible, your plan today is a $5,000 deductible. They've been cost shifting onto the employees for a decade, which means every year They have to water down the benefits to make the 30% increase look like a 15% increase. So that's another way that they've been kind of blowing smoke. So in reality, these things cost us a lot more than we actually realize. But people need to understand 100% of that cost comes out of your paycheck. They're just not giving you the first half of it before they write that check. It's coming out before they even write that check. And then the rest comes out. And then when you access that system, they really ding you. So education, you learn how this stuff works. And but that's still not going to solve the problem, unfortunately. Now, the employers we work with, I'll give you an example. So when we build what we call a high-performance health plan, employees have complete access to their own primary care doctor. So we work with direct primary care doctors, and we say, okay, this is going to be your client. These employees, you're going to work for them. The doctors go on site as much as needed. Sometimes it's twice a month. Sometimes it's once every 3 months, depending on the size of the company. They'll go to the location, and they'll see the employees at no cost to them. If they want to go to their brick and mortar practice, they can make appointments. They can get same-day appointments. There's no copay. Doesn't cost them anything to get real primary care.
Telehealth too,
and
right?
this is a DPC doctor, direct primary care doctors.
Yes, and the doctors, it's not fee-for-service, so you don't have to drag yourself in there for them to get paid. They can text, email, call, video conference.
Yeah, video conference, and it's a beautiful system.
It is. And then on the health plan, if they need something out of primary care into specialty, if they allow us to steer them to our centers of excellence where we know the quality is top rated and we know what the prices are, we know the employer is winning, that we waive all costs to the employees, which basically means they have no deductible.
It's amazing.
The only thing they pay for is co-pays on prescriptions, and we're very careful on how we design the formularies. So it's not this thing that just gets more and more expensive every year. We have clients that haven't had a premium increase for the employees on their payroll deductions for 4+ years now. They have $1,000 a month maximum out of pocket. That means worst case scenario, you get hit by a bus and you're in a hospital for the whole year. It's going to cost you $1,000. That's it. But you can get 90% of your care at no cost to you.
Wow, we could talk forever. And in the interest of time here, we're going to have to close. Can you please let people know, and I'd love to have you both on again. This is super informative and so important to discuss. Can you just tell our listeners where they can find you for any questions? And
Yes, certainly. Our website is classins.com. So it stands for Class Insurance, but CLASSINS.com. Phone numbers there. It's about a pretty high overview of what we do. We help businesses, large and small. We help self-employed individuals, and we call them the mom and pops because that's how we are. We've always been self-employed. We're part of that community, and we do what we can to help there.
Super.
And we also help people in the Medicare space.
Awesome. Okay. Thank you so much again. Everyone, George and Mary Claassen. George and Mary Claassen. I'm still waking up here, everyone. You love me, and yeah, it'll be okay. George and Mary Claassen, Class Insurance. You can find them CLASSINS.com. Your benefits consultants. You can, as a reminder, you can remember, and hopefully I will too. This is Claudette Schmidt on WSMN 1590 AM and WSMN 95.3 FM.
Listen, watch, and stream at WSMN.live.
USA News, I'm Rich Johnson. Texas is preparing in different ways for the expected surge in migrants applying for asylum in the U.S. once Title 42 ends. For Governor Greg Abbott, that means sending the Texas National Guard to the border.
They will be deployed to hot spots along the border to intercept, to repel, and to turn back migrants who are trying to enter Texas illegally.
For El Paso Mayor Oscar Leeser, it means preparing shelters for those who legally enter the USA and apply for asylum.
We have 2 schools that have been empty for years now, and we were able to get those schools, and we're going to open them up today or tomorrow and be able to offer sheltering for people that have gone through the immigration process.
Title 42 is a COVID-related directive making it easier for the Border Patrol to keep asylum seekers in Mexico or elsewhere. It's expiring along with all other COVID emergency measures. And speaking of COVID,
it's therefore with great hope that I declare COVID-19 over as a global health emergency.
But the head of the World Health Organization, Tedros Adhanom Ghebreyesus, also says COVID is here to stay, killing someone somewhere in the world every 3 minutes. Police in Brownsville, Texas, are trying to learn more about the man who plowed his car into a group of migrants outside a shelter yesterday, killing 8 and injuring many more. White supremacy figures in the investigation into the man who shot up a suburban Dallas mall Saturday, killing 8 and wounding at least 6 others. The man who was shot and killed by police wore a vest with a white supremacist logo. Closing arguments are underway in New York City in the civil rape trial of former President Trump. A writer who says Trump raped her in the mid-'90s is suing for that and for defamation. Trump denies it and says E. Jean Carroll made it all up to help sell her book. This is USA News.
Texting enrolls you into recurring automated text messages. Consent not required to purchase. Message and data rates may apply.
Hey, Dan, how you doing? Haven't seen you around the gym for a while.
Yeah, I've really fallen off. Since I turned 40, I just don't get the results I used to get.
Could be lower testosterone.
Lower T?
Yeah, I went through it a while back. Once you hit 40, your body has less free testosterone. I got Nugenix Total T, and it's made a huge difference for me.
I've seen that on TV. Is it for real?
Oh, yeah. The patented key ingredient is something called Testofen, which helps boost free and total testosterone levels to help you trim up and stay lean.
And it's made a difference for you?
Man, I feel like I'm in my 20s again, at work, in the gym, and in the bedroom.
Are they still giving out complimentary bottles for people to try it for themselves?
Yeah, you just need to send them a text.
Text STAPLE to 321-321 right now for your complimentary bottle of Nugenix Total T, the #1 selling testosterone booster at GNC. Plus, text now and we'll include a bottle of Nugenix Thermo, our most powerful fat incinerator ever, to help you get back into shape fast. Absolutely free. Text STAPLE to 321-321. That's STAPLE to 321-321.
California's legislature is a step closer to being the first in the nation to come up with a plan to pay reparations for racial injustice.
Those proposals will compensate and apologize to black people for generations of harm and racial discrimination. The state proposals agreed to Saturday include a formal apology from the state, compensation, and policy reforms that will help African Americans gain equity. Economists say reparations can cost up to $1.2 million for every eligible black person living in California. The committee is scheduled to meet for the last time on June 30th to finalize recommendations to the legislature. I'm Skip Kelly.
The Golden State's in the middle of a carjacking crisis. California leads the nation in stolen cars, more than 202,000 last year. That's nearly double the number in Texas, which is second on the list, compiled by the National Insurance Crime Bureau. The most popular targets of thieves, Chevy and Ford trucks, followed by Honda Civics and Accords. We're now in week number 2 of the writers' strike, the latest show to be affected, the MTV Movie and TV Awards. It aired last night, but it was recorded instead of going out live. The U.S. Navy has commissioned a new ship, the USS Cooperstown. It's named for the town in New York that's home to the Baseball Hall of Fame. Former Yankee manager Joe Torre was among the many former big leaguers who are also veterans on hand for Sunday's ceremony. I'm Rich Johnson, USA News.
More than 80 million Americans depend on AM radio for their news, traffic, weather, sports, and a community connection. It's the backbone of the emergency alert system, keeping us safe in dangerous times. It's critical that we keep AM radio in cars, because when cell and internet services are down, this free emergency service could be your only lifeline. Text AM to 52886 and tell Congress we need AM radio in cars. This message furnished by the National Association of Broadcasters.
Hello, Nashua. My name is Cody Switzer, and I am the Assistant Director of the Nashua Community Music School. We have been serving the greater Nashua community for nearly 40 years as a nonprofit organization, and we're counting on your support to our school's large variety of community music programs. Has music touched your life? Do you want to contribute to more innovative and accessible music programming? Then simply log on to nhgives.org on June the 6th and 7th and search for the Nashua Community Music School. Once you're there, support us by clicking Donate. With your generous donation, we can better serve greater Nashua and help to create a world where music builds community, ignites social change, and inspires artistic expression.
The Reading Foundation provides evaluation and tutorial programs based upon the Orton Gillingham philosophy of learning, based upon the study of language, how children acquire language, and the mechanisms involved in learning. All the learning pathways of the brain, visual, auditory, kinesthetic, and tactile, are addressed and strengthened to build a strong foundation for the acquisition of reading skills. If you are interested in learning more, please contact the Reading Foundation for more information. The Reading Foundation is at 10 Northern Boulevard, Unit 19, Amherst, New Hampshire, 03031, or you can email us at readingfoundation_rf@yahoo.com, and of course you can call anytime at 603-882-0992. The Reading Foundation, Amherst, New Hampshire.
The Village Network was created for only one reason: to keep those 62 and older in their home as long as possible, ideally for the rest of their life. The Village Network is the answer for children who do not live nearby and worry about their parents being able to remain independently and safely at home. The Village Network has a network of trusted providers and volunteers who provide transportation,